Hey everyone! So, if you're the person responsible for filling out the RDHS Human Resource Data form, you are in exactly the right place. I know it can seem like a big task, but this explainer is going to walk you through everything step by step to make it as simple and clear as possible. So, you might be thinking, why is this form so important? It's just paperwork, right? Well, this quote from the Ministry of Health really gets to the heart of it. This is so much more than just filling in boxes. The numbers you provide here, they're the foundation for massive decisions about where our doctors, nurses, and all our vital staff are needed most right across Sri Lanka. We've broken this whole thing down into 5 easy parts. We'll kick things off with the why, then we'll get into some key rules you have to know before you start. After that, we'll go section by section, and finally, we'll cover how to submit and who you can call if you run into any trouble. All right, section 1. Let's start with the big picture. Who exactly is on the hook for this, and why is it so critical for our national healthcare planning? So, the main responsibility for getting this done right falls to you, the medical officer for planning in each of the 26 RDHS offices. You'll be working closely with your regional director to make sure the data is spot on. It's a local effort, for sure, but with a massive nationwide impact. Let's move on to section 2. Now, before you even think about typing a single number, let's go over a few golden rules. Seriously, getting these right from the get-go is the secret to clean, accurate data, and trust me, it's going to save you a lot of headaches later on. And here they are, just 4 simple rules. First, think of this as a snapshot in time. All your data needs to be accurate as of June 30th, 2025. Second, no decimals, no fractions, just whole numbers. Third, and this is a big one, a really common mistake, never ever leave a field blank. If the number is 0, you have to type in a 0. And finally, that justification field, don't skip it. It's your chance to explain the story behind the numbers. Okay, you're going to see this term pop up in every single section, so let's get it crystal clear. No pay leave is for any staff who are on unpaid leave, but, and this is important, excluding maternity leave, and are still officially on the books as part of that institution staff. All right, with those ground rules in place, we are ready to actually dive into the form itself. Section 3 is all about the basics, starting with your own office and the institutions you oversee. Section A is a nice, easy warm-up. It's super straightforward. You'll just use the drop-down menus to pick your RDHS office and then give a quick count of the different types of facilities you manage. This just gives a high-level overview. Next up, Section B. Now, before you start detailing all the hospitals and clinics out in the field, the form wants you to report on the staff in your own central RDHS office. It makes sense, right? Start with the team you know best. Okay, let's get into Section 4. This is the real heart of the form, the core of the data collection. It might look like a lot at first, but here's the good news. Once you get the hang of the pattern for one institution, you've basically mastered the whole thing. And this slide shows you exactly what I mean. It doesn't matter if you're entering data for a divisional hospital, a PMCU, or an MOH office. The layout, the questions, the fields, they're all identical. You learn the pattern once, and you just repeat it for every facility. This table really breaks down that pattern perfectly. For every single staff position in every single facility, you're filling out these 5 columns. It's got a great logical flow. What's officially approved? Who's actually there right now, what's ideally needed, and of course, that spot to explain any differences. Okay, so you've just finished entering all the details for your first hospital. You've filled everything out. The next question is obvious. Great, now how do I add the next one? The answer is this little plus button. Now listen up, because this is absolutely crucial. You have to click this button to open a brand new, clean section for your next institution. Don't try to go back and edit the one you just finished. Every single facility needs its own separate entry. You just repeat that process for every hospital, every PMCU, and every MOH office. And just like that, all your data is in. You've done the heavy lifting, and now you are on the home stretch. In this last section, we'll cover the final, critical steps, reviewing your work, submitting it, and knowing who to call if you need a hand. Before you hit that final submit button, just pause. Take a minute for this quick review. Double-check your numbers, make sure you didn't accidentally forget an entire hospital, and do one last scan for any of those pesky blank fields that should have a 0. And hey, no pressure. You can always use your form link to go back and make changes right up until the deadline. The Kobo Toolbox platform is actually pretty smart and makes this part easy. It automatically saves your work as you go, and when you're connected to the internet, it uploads your data every 5 minutes. But if you want to be extra sure and send it through right away, just hit that upload button yourself for instant peace of mind. And finally, and this is so important, please remember you are not alone in this. If you get stuck, if you have a question about a specific field, or if you run into a tech problem, this team of senior registrars is there to help. All their contact info is right here, so please don't hesitate to reach out. You know, the care and the attention to detail that you bring to this form, it has a real, direct, and powerful impact on healthcare planning for the entire country. The data you're providing is absolutely vital. So thank you, really, for your essential work in making our national healthcare system stronger.